We know a lot more about autism than we did 20 years ago, but for families, a diagnosis still means the start of a very confusing and daunting journey. All month, we are covering the spectrum, from personal stories to the challenges families face raising kids on the spectrum. Dr. Emily Myers is the medical director at the Boyer Children's Clinic in Seattle. Dr. Myers and her team work to educate families, making sure that they have access to medical care, therapy, and support services. Thank you so much for being here. So we hear so often how important it is for families to get diagnosed early, but we also are hearing that it takes a lot of time. People are on wait lists for a very long time. Why is this?
I think part of the challenge is that the early access to accurate diagnosis, there's very few people who have access to that. So there's only a few people who are trained to give a diagnosis of autism spectrum disorder. And so in order to get access to those few people, many people have to wait a long time.
Is there any way to expedite that process?
Oh man, people are studying that. In fact, I'm studying that right now, but people are studying that. But at the moment, I think being patient and persistent, I always tell families who are waiting that it's a marathon, not a sprint, and the squeaky wheel gets the grease. So once your referral is put in, calling every couple of weeks and being a nice person just to check in to find out where they are on the wait list and be available if a slot opens up is always good.
So there's some hope. Be ready. With so many kids being diagnosed, can you share with us what the autism assessment entails? What are you looking for?
So with a child that I am seeing at Boyer Children's Clinic, I'm looking for certain clinical and developmental patterns of how that child communicates verbally and non-verbally, and how they interact with the people around them and how they play with toys. And so the assessment usually involves meeting with a family and talking with them about what they've seen in their children as they've grown and developed up until now. And then oftentimes it will involve further diagnostic assessment with a speech therapist or a psychologist to sort of flesh out exactly what's going on.
Every week you're sitting down with parents, you're giving them that diagnosis that they don't want to hear, that their child has autism. What do you really want them to know at that point?
What I like to tell my families, because I do this several times a week, is that their child is the same child that walked in through the door before I gave the diagnosis. And that just because a child has autism doesn't mean they can't grow up, go to college, have a family, and do happy, healthy things. And so I try and reassure families as much as I can that though their child is developing differently, that doesn't mean that their child is not going to develop, and that early diagnosis is so important and they're doing a really good job.
At Boyer, you advocate that kids on the spectrum join playgroups, learn side by side with their peers. Why is that so important?
Well, we learn from each other. Everybody does through our whole life. And I think it's important that children on the autism spectrum who have trouble learning how to relate in a way that we would expect them to be able to do by their age get to interact with kids that are doing it differently and model and support one another. So watching children interact with one another and practice on each other is really important.
Two big things that families face with that first diagnosis is the obstacle of time and also of money. How do you help families face those hurdles, and what sets some families apart?
I think I hate to say that I have to ask what health insurance a family has when I'm giving a diagnosis, because the access is different depending on what insurance you have. I think I say it's really important to be a savvy consumer of what is put in front of you. And oftentimes the treatment of a newly diagnosed child involves going to multiple different therapies that can span several days of the week, and trying to balance the life and health of the family with the needs of the child. Because if you don't have a healthy family that's financially viable, it's very hard to have a healthy child too. So I try and be healthy and holistic about it.
And hold these families' hands through a very confusing process. We're so glad that you're here. Thank you for joining us, Dr. Emily Myers. And if you would like to read more about the Boyer Children's Clinic and some of the other stories that we are covering during Autism Awareness Month, go to Q13fox.com and search autism.